Thank you, Madam Speaker. As I begin this evening, I want to recognize that both ministers have been over 3 hours now providing answers of substance to all parliamentarians, and I appreciate them for that. I'd like to start by following up on a letter I sent to the Minister of Health, and we had a conversation about a month ago, calling to renew investments for support and training for HIV self-testing kits. As a reminder to the Minister, in my community, the AIDS Committee of Cambridge, Kitchener and Waterloo area recently expanded their services to Guelph, Wellington, and for over the past year, supported over 600 people in testing for HIV. 94% of the people engaged requested assistance from a peer worker to ensure they understood and completed the test correctly. And so while the test kits remain available, the funding for support from a peer worker had ended. When we last spoke, the Minister had shared that he was planning to look into this. Can he share if the federal government will resume funding for the support of these self-test kits, and if so, when?
The Honourable Minister has 1 minute to respond.
Thank you very much, Madam Speaker, and thank you to member for his question. I appreciate the continued conversation on this topic, and I really appreciate his very earnest advocacy. It's an area where we know when folks get tested, we can get them the drugs that they need, and it becomes a very manageable condition rather than what it had been in the past, the death sentence. And it is totally remarkable for me to be able to talk with folks and see the transformation they can have. So in the first order, the pilot project, the test kits will continue, as I've mentioned. The support around them, we're continuing to look at how that might be possible. And obviously there's provincial jurisdiction here, and provincial partners need to be coming to the table with their own action in this space. But, you know, we really need to make sure that people get tested. That's not just a federal responsibility. So these kits will continue to be available. We're looking at how we might have supports that are around that. This was a pilot project, and we are, helping provinces here, but they really need to be stepping up as well.
The Honourable Member.
Would the Minister or a member of his team be open or to accept a meeting with ACWA to hear directly from them about how important the support for these test kits is?
The Honourable Minister of Health.
Absolutely, I would welcome that. And I think one of the things that I could say really rapidly, and the member can give me more time if he chooses, so he can come back. Because I have enough, if he wants to ask me and give me a little more time on that piece, I have something else to add.
Honourable Member.
Thank you, Madam Chair. I need to move to the next question. My next question is on a concerning limitation, Bill C-64, brought to me by a senior in my community. Now, the bill, of course, is designed to provide coverage for specific prescription drugs and products intended for contraception and the treatment of diabetes. My concern of that and that of this constituent is that critical equipment to administer medication and to monitor blood sugar levels for people with diabetes, like real-time continuous glucose monitoring devices, are not included. Instead, the Health Canada website states that, quote, the federal government is announcing its intention to establish a fund to support access to diabetes devices and supplies, end of quote. Glucose monitoring devices cost between $2,000 to $6,000 per year and are a crucial part of diabetes management. And so while providing insulin is an important measure and Greens support it wholeheartedly, I'm concerned that this senior is still being on the hook for hundreds of dollars a month for this essential tool in managing her diabetes, even with the passage once we get there of Bill C-64. Will the Minister commit to establishing this fund to ensure that glucose monitoring devices required by diabetics will be covered across the country, and if so, by when?
The Honourable Minister.
Yes, absolutely. I think that the fund is established specifically for that purpose. Now, it's going to vary province to province, but what I want to be able to see for those that are in need and who are in income insecure situations, that we are going to have that ability to do that. And one of the things to go back to because now I get a chance to go back to the other issue. One of the things talking about sexual health and about contraceptives is, as we're having conversations in the pharma space, I'm having conversations like with Manitoba about, because they're really taking leadership there, to see that how we can spread and increase that action around sexual health. And to me, that certainly includes action on AIDS.
Our member.
I'm encouraged to hear that on both fronts. I appreciate that. I'd like to share with the Minister about another constituent of mine, Noor Aisha. Noor is battling an incurable rare cancer. For it, she requires an oral drug. The name is Pemazyre. It's been approved by Health Canada, but is not recommended by the Canadian Drug Agency for public coverage. So Noor's oncologist recommends she take this drug to help her live longer, but it costs $800 per tablet. They have to be taken daily. It's a cost of over $15,000 per month. Here's what Dr. Jennifer Knox, a medical oncologist at the Princess Margaret Cancer Centre, professor of medicine at the University of Toronto, here's what she had to say about Pemazyre. Quote, "This drug represents real progress, a key scientific and clinical advancement. Noor's family has had to turn to starting a GoFundMe to help her fight cancer and live longer because the Canadian Drug Agency hasn't recommended Pemazyre for coverage." My question for the minister is, what steps is the government taking to address this gap between Health Canada's approval of rare cancer drugs and the CDA's recommendations for public coverage to ensure that patients like Noor can access the treatment they need without prohibitive cost?
The Honourable Minister.
Thank you, Madam Speaker. And in the first order, I want to say through you to the member and to Noor how sorry I am that she's going through this, and to her family, and how dreadfully difficult it would be to get that diagnosis and to live with that condition, but then have to worry about her medication on top of it. And we do have action on drugs for rare diseases. We're negotiating now with provinces to try to identify what drugs we can see to help folks who are in these conditions where there are a rare condition with rare drugs, so that they can help deal with these extraordinary costs. But it's one of the reasons why it's so important that we take the collective action we're taking with pharmacare and take these steps, because we do need to get to a world where everybody gets the medication they need and they're not in the kind of situation you're describing that Noor was in, or that the member was describing Noor was in.
The Honourable Member.
Thank you, Madam Chair. Can the minister share more about what can be done working with provinces and territories to address this seeming gap? The issue why it seems like Noor can't access is, of course, because it's approved by Health Canada but not listed by the Canadian Drug Agency as a recommended for public coverage. Can you share more just briefly about what can be done working with provinces and territories to address this?
The Minister has 25 seconds.
Thank you, Madam Speaker. Given the level of specificity, perhaps the member could send me the specific details and I can get directly back to him. I want to be precise and I want to be able to dig into the specific circumstances as it relates to that exact drug. It's a very fair question. I want to be able to do that for both him and for Noor.
The Honourable Member.
Absolutely be happy to do that and appreciate the specificity. I'd like to ask next about Dylan and Kim. They're two of many parents in my community who've shared with me what it's like to raise a child living with CF. In their case, it's their son Jackson. Now, as you know, Madam Chair, kids like Jackson need expensive medication like Trikafta that can significantly improve their quality of life. Given the high cost of Trikafta and other CF drugs, many families struggle to afford it unless covered by private insurance. Those that don't have access often only do, or those that do have access only do because of private access through or private insurance through their employer. It often means that the value of this coverage is actually more than the person makes in their salary. Of course, no child should go without essential treatment due to their family's financial constraints. My question for the minister is, can he share when this government plans to move forward with the pharmacare program that would include drugs like Trikafta, and at minimum, maybe at least would require private insurers to cover the drugs that public plans do, as I understand already is the case in Quebec, and as CF Canada is calling for?
The Honourable Minister.
Thank you very much, Madam Speaker. So first of all, to Dylan and Kim, I appreciate your advocacy. I can't imagine how difficult that circumstance is, and that's exactly what we want to shut down. This is precisely why we're acting in pharmacare. Now, one of the questions that we have, and I think it's very important, we have a pilot in PI that's working very well. It's based on a fill-in-the-gaps model. The model that BLC 64 is based on a universal model. And so looking at now in a real world, those two models and which one is best to use as a delivery mechanism for all drugs is, I think, the question. We have a committee that's going to be looking at that over the next year and really painting that path forward. So these are very active matters of consideration. And I think it's one of the reasons why it's so important we establish that bedrock, which is the legislative foundation for pharmacare in Bill C-64, and take this action so that we can make sure that we get to help families like Dylan and Kim. That is envisioned in Bill C-64, but very much in my heart and in my mind as we're working.
Thank you, Madam Chair. As the Minister likely knows, I'm hesitant to use the word pharmacare at this point because it's so restrictive to contraceptives and diabetes. I know that that's his vision for where he wants it to go. I'm thinking for parents like Dylan and Kim who want to understand more when this could be expanded to them, could we hear at least the Minister's aspiration for when he would look to see that expansion in place?
The Honourable Minister.
Well, thank you, Madam Speaker. And I would say that our healthcare system has always been iterative. We've built it out a piece at a time, and and that means that, you know, one of the most frustrating things for me as health minister is to go to different parts of the country and hear stories of things that we could do on a preventative basis and aren't doing. I mean, we could talk about in Iqaluit, you know, I was up talking with Indigenous leaders, Inuit leaders rather, about tuberculosis outbreaks out there. Like, there are things that we still have happening.
The Honourable Member.
Thank you, Madam Chair, and I would love to continue that conversation with the Minister. As the Minister knows, Canada also has one of the highest rates of MS in the world, with more than 90,000 Canadians living with this disease. And of course, while the cause is still unknown, emerging research has highlighted the potential for significant advancements in the prevention of MS. I've heard directly from constituents that they want to see the Government of Canada commit $15 million to fund MS research in partnership with MS Canada, focusing on prevention, repair, and regeneration. I understand that the Minister has also met with MS Canada just earlier this month. Can he share what it will take for this government to commit these funds?
The Honourable Minister.
Well, I'm extremely happy in the last budget to see us respond to the Bouchard report and be putting very major money, I think it's $2.5 billion into research, generally a very significant portion for health research. Through the Canadian Institute for Health Research, we've funded an enormous amount of research into MS. The member is absolutely right. Canada is a leader, unfortunately, when it comes to MS, and so we also need to be a leader in research. And so when I look at these investments, it's certainly my hope that that independent agency will be taking a look at these requests and deepening our commitments in research. But those dollars in the budget are absolutely essential to that end.
Member.
I appreciate the Minister for meeting with MS Canada. It's best to hear from them directly than from me, but also to know that there are parliamentarians across all sides who are keen to see that investment made, potentially, for example, in the next fall economic statement. I'd like to turn to a question to the Minister of Mental Health. Madam Chair, there are two local mental health service providers in my community, Thresholds and the CMHA of Waterloo, Wellington, who've been struggling for months to secure funding for a mental health emergency room to provide appropriate care for people in crisis and to alleviate strain on overcrowded emergency rooms. There hasn't been government funding available, so they've had to open this summer using their own budgets, and they've got about 3 months of staffing support available to demonstrate how critical this support is. Given the urgency of the situation, of course the provincial government also needs to step up, but given the urgency and the critical need for this kind of facility, I'd like to hear what the Minister believes the immediate actions the federal government could take to support these kinds of local initiatives and ensure that people in crisis have access to the care they need without overburdening emergency rooms.
Last question, depending on how long the answer is, the Honourable Minister of Mental Health and Addictions.
Thank you, Madam Chair, and thank you to the member for his question. I know he's such a staunch advocate on mental health and helping those who use substances in our communities. Madam Chair, I don't think there is a quick fix to getting our health systems to incorporate mental health in the full spectrum of care. This is why we are taking an integrated approach through the bilateral agreements. As I mentioned earlier in the evening, just for example, in Ontario, $700 million of their $3.1 billion bilateral agreement is towards mental health and substance use, and we have to move the needle. We're not there yet. Community service organizations have been the bedrock of providing mental health services in this gap that we see across jurisdictions. That being said, this is exactly why programs like the Youth Mental Health Fund are being put into place in Budget 2024, but there aren't quick fixes. We are moving mental health into the healthcare systems. We are seeing, for the first time ever, there are mental health ministers in nearly every jurisdiction across this country, which shows us that there is a prioritization to work collaboratively. I'm happy to meet with the member to talk about what's going on in his own community with regard to CMHA, and local CMHAs do terrific work, and happy to discuss.